Good afternoon, everyone. My name is Elizabeth Roldan. I'm here from IMAC Insurance. I really appreciate you all jumping on this webinar this afternoon. This is the 2024 Open Enrollment and Move to Horizon Blue Cross Blue Shield of New Jersey for Wallington Public Schools. IMAC Insurance is the broker for the district's health benefits. We are also your insurance claim advocates. So if you ever have a situation with a claim or a prior authorization or anything related to your prescription, medical, and or dental benefits, please feel free to reach out to our office directly. We have a dedicated team to the district that can help resolve those issues in real time for you. You can call our office at 973-450-9800, or you can send us an email at info@imacagency.com, and we will go ahead and get back to you in real time, usually, within the hour. We are also very much available right now to go ahead and answer your open enrollment and move to Horizon Blue Cross Blue Shield questions, as we know that this is going to be a kind of a change, but a good change. So I really want to preface that. Wallington Public Schools will be transitioning its current medical and prescription plans from the state health benefits to Horizon Blue Cross Blue Shield effective January 1st of 2025. You are also entering your annual open enrollment period, which began this week on October 15th and will be running through Friday, November 15th. Open enrollment is your annual opportunity to review and make any plan changes or add or remove any dependents. During this open enrollment, as well as this transition to Horizon, there is no change to your dental benefits. So dental is staying exactly the same that it is. If you are somebody that is looking to waive their coverage, you do have to complete and submit a waiver form. We do have that on the portal as well. Because of the transition and move to Horizon Direct, if you currently have a dependent that is over the age of 26, and that is currently enrolled under Dependent 31 coverage for medical and or prescription, they will be required to re-enroll with Horizon. That's something that really doesn't apply to everybody. It applies only specifically to people that have overage dependents that are part of the Dependent 31 coverage. But if that is a situation that applies to you, please note that they will have to re-enroll with Horizon, and we do have that enrollment form on the IMAC benefits portal. Now, as of January 1st of 2025, you will have the same plan offerings that you currently have through the state. You'll have those through Horizon Direct. The benefits are equal to or better than. The 4 plan options that you'll have are Direct 10, Direct 15, the New Jersey Educators Health Plan, and the Garden State Health Plan. For those of you that were hired on or after July 1st of 2020, your only 2 options are the New Jersey Educators Health Plan or the Garden State Health Plan. Anyone else during open enrollment, like I said, this is your opportunity to make any plan changes. Although if you are someone like someone that we were just talking to before we started the meeting, if you aren't making any changes to your benefits during open enrollment, whatever is in that you're enrolled in right now, that is what's going to be rolled over into Horizon. So if you're currently in Direct 10, you're going to be in the Direct Access 10 come January 1st with Horizon. Same thing. So if whatever your information is in Benefit Solver right now and that you're currently enrolled in, if you're not making any plan changes, that is what's going to continue come January 1st under Horizon for both medical and prescription. With your medical plans, there are specific prescription plans that follow it. So depending on the medical plan that you choose, the appropriate prescription plan will follow it. So for those of you that are in Direct Access or Direct 10 and 15, you will have the $3 generic, $10 brand plan. For those of you in the Educators or the Garden State Health Plan, you will have the prescription plan that is $5 for generic and $10 for brand. So again, whatever you choose as your medical, you have the corresponding prescription that follows it. The same way, the same rules that you have now in the state follow that once you're going to be in Horizon Direct come January 1st. One of the big takeaways that we want everyone to understand today is that you will be getting new ID cards. Come January, you will have to present your new ID cards at your doctors and your pharmacies. You will be getting those cards right before the plan starts. So late December, I would say within a week or 2 before the plan actually starts. That is when Horizon usually mails them out. You will have one ID card for both medical and prescription. On your card, it'll have your information as the subscriber and the coverage level that you have. So if you have a family plan, it'll say Jane Doe family plan. The cards will not list every single dependent that you have. Those dependents are noted on the card because of your coverage tier. So if you have parent and child coverage, it'll say PNC. If you have family, it'll say FAM. But your ID cards will be mailed to you, like I said, about a week or two before the plan actually starts. Once you receive those ID cards, please double check them to make sure that you are enrolled in the correct plan and that the correct coverage level. So if you are enrolled in family, make sure that your card says family coverage. And if there are any issues or errors on your card, please reach out to us. We will go ahead and work with Horizon to get you new ID cards issued as soon as possible. And again, the big takeaway is since you are all going to be getting new ID cards, please make sure that as of January 1st, you are presenting them at your doctor and your pharmacy. I can't tell you how many times it happens that members forget to present that new ID card when they have a change in coverage like this. And that then they'll call our office and say, hey, the new plan isn't working for me. My coverage isn't being accepted because you're presenting the wrong card. So it's very important that you present the correct card. On or after January 1st, you can go ahead and actually log into horizonblue.com and create a user account where you can actually print or get a digital copy of your ID card. I would highly recommend that if you don't have a Horizon account created, that you do, because there's a lot of great information on there, such as discounts for Horizon members. You can get copies of your explanation of benefits. And there's a whole host of other money-saving tools that Horizon offers its members once you're actually in the system, again, on or after January 1st of 2025. For those of you that have any medical prior authorizations, we actually spoke to a member this morning who reached out with regarding to this. She has a surgery right after the new year. And we told her that we would go ahead and have that pre-authorization that's in place. So for example, if you're having a procedure right after the new year that your doctor has already scheduled, that you already have a prior authorization for, your doctor, you don't have to go through the process of doing all that all over again. We will go ahead and have that moved over from your Direct 10, 15, or Educators plan into your new plan come January 1st. So that'll happen behind the scenes, but we do need to be notified of that. So reach out to our office if that is something that is applicable to you. If you are somebody under the Garden State Health Plan, however, because that's currently with Aetna, you will need to go ahead and have that authorization obtained under Horizon. Reach out to our office. We will walk you and your provider through it. But again, for the most part, I believe most everyone in this district is either in Direct 10, 15, or the Educators Plan. So like I said, if you have any medical prior authorizations in place, we can have those moved over seamlessly without you having to go through that process again with your doctor. For those of you that have prescription prior authorizations under OptumRx, which is your current prescription provider, you will need to obtain a new prior authorization under Horizon because it's a different carrier technically. Some medications that are in Optum do not require prior authorization under Horizon and vice versa. But the rule of thumb is if you have a prior authorization already for prescription, please let us know about it. But also, you will have to have your doctor obtain a new approval through Horizon. I'm seeing a question here in the chat. It says, just to double check, I'm currently in the Educators Plan. I'm staying in that plan. Do I need to submit any paperwork? No, you do not. And I'll say it a few times because I think it's important. It's worth repeating. If you are not making any changes, you do not need to take any action. Everything will be moved over electronically. Everyone does not have to complete a form. The only people that have to complete a form are those that are actually making a change. The only thing that I will tell you to this gentleman that is asking, please make sure that you receive your new ID cards and that you are presenting them as of January 1st. That is of the utmost importance to make sure that your claims are processed correctly, that you can, when you go to the prescription pharmacy to pick up your medicine, that it will be processed under your plan. But again, that's really the biggest takeaway is that no action required if no changes are being made, and to make sure that you get your ID cards as of and start presenting them as of January 1st. So just to go back to prior authorization. So again, if you do have one in place, you will have to have your provider go ahead and set that up already. Very important to know that if this is an issue that affects you, or if your doctor is unsure of how to get this process started, reach out to our office. We will walk you and your provider through that. On the portal right now, on the IMAC benefits portal, we do have all the plan options there loaded. Again, same benefits that you have now, because the move to Horizon was equal to or better than what you currently have in the state. We have all 4 plans loaded on there. You can do a plan side-by-side comparison. I know that some people are considering moving from the Direct 10 to the Educators plan. We have a great comparison tool that will help you line by line look at all of those benefits. I would highly recommend that you take a look at that if you're considering making a change. And we are going to be going through some of the plan highlights and the plan differences between Direct 10 and the Educators plan. One of the questions that we get a lot is there is a guaranteed savings from moving from Direct 10 or Direct 15 into the Educators plan. But the question that we get a lot is how are your contributions calculated? So as you can see from this graphic, the first level here, your Direct 10, your Direct 15, those are calculated based on your coverage tier, your salary, and the premium of the plan. So every year that there is a plan increase, your contributions will be going up. But under the Educators plan, the premium is not calculated into that contribution amount, only your coverage tier and your salary. So if you don't have a change in salary, your plan will not be changing, even though the premium of it goes up. When the NJEA worked with the state legislature to develop the Educators plan, savings was a critical component of this because they wanted to provide savings relief to employees in school districts, which is why there is a guaranteed savings moving from Direct 10 to the Educators plan. There are plan differences, and those are what we're going to be focusing on today. But I like to use this graphic because this is a very big question that we get a lot. So just some of the plan highlights here. The Educators plan and the Garden State Health Plan both utilize the same network of doctors. So all 4 plans that are being offered to you have the same network of doctors. They use what's called the Horizon Managed Care Network. The only difference is that the Garden State Health Plan only offers coverage in the state of New Jersey. There is no coverage outside of New Jersey under the Garden State Health Plan. And that is the only one. The other 3, Direct Access 10, Direct Access 15, and the Educators plan, all have coverage within New Jersey and as well as nationally. Someone here that is asking a question, I see, and I'm sorry to interrupt. I want to answer your questions in real time. Person says, I'm in Garden State with Aetna. If I do nothing, will I be moved to Garden State and Horizon? What will be the premium difference? In your case, because the Garden State Health Plan, so to answer your first part of your question, yes, it will be moved to the Horizon equivalent. So the benefits are going to be exactly the same. It'll just be under the Horizon network. So I would double check that while there is a lot of network overlap, I would double check that those providers that you are seeing in network now, that they are also in network with Horizon, since you're moving from an Aetna plan under the Garden State Health Plan. Person's also asking, what is the difference between the premium? It's calculated based on a percentage of your salary. So there is no change in premium with the move. Whatever you're paying now, if you don't have a change in salary or coverage tier, is what you'll be paying in January for your contributions. Another person is asking, how is the move the district is making us for saving money? It is a cost savings measure, but it's not just for the district. It's also for you as the employee. This year, had you not moved to Horizon Direct, the district was facing an 21.9 increase to their benefits. Horizon was able to provide a savings to that, which is what is prompting this move. Believe me, people that can't leave the state because their claims experience isn't good enough, they are going to be paying a lot more for their benefits come January. So this is a cost savings and a cost avoidance measure that the district has put in place. But yes, the savings is not only for the district, it's also for the employee because you pay a portion of your benefits. Just going back here to the presentation until we get some more questions. So as I was saying, the Garden State Health Plan only offers coverage in the state of New Jersey. There's no coverage outside of New Jersey. Contributions for the New Jersey Educators Health Plan and the Garden State Health Plan are calculated as a percentage of salary rather than a percentage of the premium, hence why there is savings, a guaranteed savings from the Garden State Health Plan and the New Jersey Educators Health Plan. Both of those plans offer a $10 copay at your primary care, a $15 specialist copay, a $125 copay at the emergency room, but that is waived if you're admitted into the hospital. And there is also the same benefits that you have as far as the enhancement to your benefits, I should say, of the gym reimbursement and the other perks and discounts that Horizon offers. Those are also offered under the Educators and the Garden State Health Plan. But your out-of-pocket costs may be higher if you utilize out-of-network providers. And there's also a difference with the prescription under both of these plans that we will be getting into a lot more detail. Before we go on to the next slide, someone is asking, some of my medications are not on the new delegated prescription plan as brand, only generic. Is there a way to pay more to access other plans so I can get brand? I need a little bit more information from you. Are you someone that is maybe in the Educators or Garden State Health Plan? But I think that I need additional information, and maybe that's something that we should talk offline. Yes, so because you're in the Garden State or in the Educators Plan, those two plans have a more restrictive formulary, and that's going to be the same under Horizon Direct. That is how the legislation was written for those two plans. Every carrier that has those plans has to follow that. We can certainly talk offline more about what specific drugs you're on and what you can do in your specific situation. I would highly encourage you to reach out to our office directly. Thank you. Some other plan highlights with regards to the Educators and the Garden State Health Plan. Because the plans offer, like I said, a guaranteed savings, there are benefit differences, specifically really out of network, where if you go to an acupuncturist out of network, under, again, only the Educators or the Garden State Health Plan, that is limited to $60 a visit. If you go to physical therapy out of network under the Educators or Garden State Health Plan, that is limited up to $52 a visit. And for a chiropractor, there is a 30 visit max, and that's up to $35 per visit. Again, out of network in the Garden State or the Educators Plan. Someone is asking, where do I access providers in the Garden State Horizon Plan? I'll show you when we get to that slide, but on Horizon's website, you would just pick Garden State, but I'll show you that. But again, it's the same providers that you have now. If you, for example, are switching from from an Educators or Direct Access Plan to the Garden State, that's the same network. I assume you're in the Garden State with Aetna and you're looking to switch into the Garden State with Horizon. So we have a slide coming up on how to do that search for providers directly on Horizon's website. So just to compare all four plans against one another, the network is exactly the same in New Jersey. The Horizon Managed Care Network, that's the same for all four plans. But again, the Garden State Health Plan only has coverage in the state of New Jersey. Your national network is the PPO network for Direct 10, Direct 15, and the Educators Plan. Primary care and your specialist copays are specific to the plan, but for the most part are $10 and $15 under all four plans. Same thing with your specialist copays. Your annual visits are no copay if you go in network under any four of the plans. And just to get into a little bit further detail, your annual deductible in network for all four plans is $0. So the moment that your plan begins, there is no deductible if you're staying in the network. If you are going out of the network, it would be subject to the specific, whether it's single coverage or family coverage. And we have those annual deductible limits listed here. Same thing with out-of-pocket max, which is the most that you would spend in a calendar year. There are certain limits in and out of the network. In network, it would be 400, 800 for Direct 10 and Direct 15. For the Educators and the Garden State Health Plan, it would be either 500 for an individual or 1,000 for a family. And same, you have $2,000 and $5,000 as your out-of-pocket maxes for out-of-network. All four plans do not require a referral, so you can go to any doctor anytime without having to worry about getting a referral from a primary care physician. Your labs are the same across all four plans, which are LabCorp and Quest. And even if you're having blood drawn in the office, which was a question we got earlier this week at another presentation, I would just make sure that you let your doctor's office know to send it to LabCorp or Quest. Sometimes some of these doctors' offices have their own, believe it or not, labs, and they want to push members to use that. But your covered labs are LabCorp and Quest. So please make sure that if you're getting your blood drawn in your doctor's office, that you notify them of that. Outpatient surgery, there is no charge in the network. Out of the network, there is your applicable deductible and coinsurance amount. Your emergency room copays are staying the same as everything else is because everything is equal to or better than. Your emergency room copay under Direct 10 is 25, Direct 1550. Educators and Garden State is 125. But again, in any of the 4 plans that are being offered, that emergency room copay is waived if you're admitted into the hospital. So when we talk about out of network and how in the educators and in the Garden State Health Plan, how it differs is because they use a different table. So under your Direct 15 and under your Direct 10, they use a table called Fair of Health. That is the table that tells Horizon, hey, this is how much we're going to reimburse for that out of network provider. Under the Garden State and the New Jersey Educators Health Plan, however, they utilize the Medicare table. So if you have anyone like an older parent or any family members that are on Medicare, that is the table that is used to determine for out of network under the Educators and Garden State Health Plan. It is a table that reimburses less, which is something that we like to really stress and highlight to people that are considering moving from Direct 10 to to the Educators Plan, that you make sure that if you're someone who's going out of network with a high degree of frequency, this is going to be kind of a red flag for you because you're going to have higher out-of-pocket costs. I spoke to a member this week who is going to 3 different therapy sessions a week to an out-of-network provider. And we kind of crunched the numbers as to what she's currently getting reimbursed back from Horizon versus what the doctor out of network is billing her. And, once we ran the numbers and looked at her savings, she definitely would eat away at her savings. And, she agreed that this was not a good fit for her. These plans, the Educators and the Garden State Health Plan are terrific plans, but they are not one size fits all. So it's important that you take a look at how you and your family are utilizing your benefits to make sure that this works for you. Just to really further elaborate on out of network and how that functions really, if you go to an out of network provider under the Educators Plan or the Garden State Health Plan, let's say that provider bills you $100, Horizon will be taking a look at that to determine what the usual, customary, and reasonable amount of coverage would be for that service that was provided. And in this scenario, let's say they determine that that $100 bill really should have been $50 that was billed. Horizon's going to pay their 70% here in this orange box as their co-insurance, so $35. You as the member are responsible for the other 30%, which is your co-insurance amount that gets applied towards maximum out of pocket, which is 15 here in this purple box. But in this red box that we still have this other $50 that has to be paid out to this provider, that is known as balance billing. It is important to note that you as the member, because you're going to an out-of-network provider, that is what your responsibility is going to be. So it's important that you know that you're going to get less money reimbursed out of network under the Educators and the Garden State Health Plan. So it's important that you understand that functionality of it. If this is the situation that applies to you, I highly encourage you to reach out to our office. We have these conversations all the time with members one-on-one just to see how they're currently utilizing their benefits and if the plan would be a good fit for them. Moving over to the prescription side of things, as I said earlier in the meeting, depending on the medical plan that you choose, you will have a corresponding prescription plan to follow it. So if you're somebody who is in the Direct Access 15 or 10 plan, the formulary list under Horizon is called the Classic Formulary. We actually have a link as well as a hundreds of page PDF of this formulary for 2025 that's already laid out. So if you wanted to go ahead and do a search to see how your drugs are covered, definitely take a look at that because again, you're moving from OptumRx to Horizon for your prescription. For those of you that are in the Educators or the Garden State Health Plan, your formulary or list of drugs is called the Net Results Enhanced Formulary. We have, like I said, the links on the IMAC portal right now. We also have the PDFs for the entire list of drugs that are for each of these formulary lists. Just note that as new drugs come onto the market, the formulary lists in both cases do change. So as new drugs come out, as new generic drugs come out, it's important that you are aware that formulary lists are always subject to change. And like I said, we do have the link on the IMAC benefits portal. And just make sure that when you're doing that search that you're selecting the appropriate formulary for the plan that you're enrolled in. Any questions so far? I don't see any new after the Garden State Health Plan question. Here, new question here. Am I understanding this correctly? When we switch, we need to get new prescriptions for medications that we regularly use. If you are someone that has a prior authorization in place, so for example, if you're on a cholesterol medication that you've been taking for a long time, there's a prior authorization in place. There's a, yes, for a prior authorization, any medication that requires a prior authorization, yes. If your drug does not require a prior authorization, which means really that if your doctor did not have to supply clinical notes to prove medical necessity for that, all you need to do is just present your new ID card at your pharmacy. If your local CVS has your prescription on file for thyroid, for any, whatever the medication is for, you just need to present your new ID card come January because your pharmacy doesn't know that you've switched carriers. If you're somebody who's getting mail order drugs, which we are going to get into in the next two slides, you definitely have to set that process up because it's a different mail order company that will be handling your prescriptions. So we are getting to that. So a good question so far. We just put together a little comparison here of how your prescription plans compare. So for example, for those of you that are in Direct 10 or Direct 15, your generic drug copay is $3, preferred brand is $10, and non-preferred brand is also $10 for a 30-day supply at retail. If you're someone in the Garden State Health Plan, however, the plans or the Garden State Health Plan or the Educators Plan, they both require what's called mandatory generics. So a generic drug is going to cost $5. A preferred brand drug, which is a drug that does not have a generic that is not excluded from coverage, that is a $10 copay. But a non-preferred drug, which is usually a drug, and I'll use Crestor as an example. Crestor is the brand name of a cholesterol medication. Crestor is excluded from coverage under the Educators or the Garden State Health Plan, but its generic equivalent would be covered at a $5 copay. And again, that is completely under the Educators and the Garden State Health Plan. So it's important to note that your medical plan will also dictate the prescription plan that you will be getting. So it's important that you understand not only how you're using your medical, but also how you're using your prescription to make sure that both of those components work good for you. So again, the Educators Plan, the Garden State Health Plan, they do have that mandatory generics. So that is very important to note that the reason why there is a cost savings moving into the Educators or Garden State Health Plan is because of the out-of-network. They're going to reimburse less for out-of-network doctors under those two plans, and the prescription coverage is different as well. As I said, we do have the links for the formularies on the IMAC benefits portal, so it's important that you do a search if you're considering switching into either of those two plans. Someone is asking here, I get a 90-day supply of a prescription medication under the current OptumRx coverage from a local pharmacy. Is that no longer an option? No, that's completely an option. You can get a 90-day supply either at retail or at mail order. It's more common through mail order than at retail, but yes, that is still an option. Just make sure you're presenting your new ID card. But 90-day option is still available. That's not going away. That's staying as is. Again, I think I mentioned this, but I'll say it again. Under the Educators Plan, it does have what's called that step therapy. And again, Educators and Garden State Plan only. Members that are in either of those two plans that went through step therapy under OptumRx do not necessarily need to go through that process again with Horizon. It depends on the clinical notes that your doctor has on file. And if they can provide that, that makes the process a lot more smoother. This is something that doesn't necessarily apply to everyone, but we want to just make sure that we highlight this. I know that this was part of the communication as well that was emailed out to you earlier this week. But again, there is step therapy for the Educators and the Garden State Health Plan. If you've already gone through that process, reach out to our office just to make sure that we can walk you how that will look like under the Horizon prescription plan come January. Person is asking to please clarify, under the educator's plan, you must use a generic if available. Yes. I'll give you a prime example. Under the educator's plan, and then I think I used Crestor as my example. Crestor is a brand. Because it has a generic equivalent that is much less expensive, that is the drug that will be covered. You can certainly continue to get Crestor, but you will be paying completely out of pocket for it. So that is a big distinction to make. That's not to say that there aren't brand name drugs as coverage. There are. For example, a very popular drug that's out there right now is Ozempic. Ozempic is covered under the educators or the Garden State Health Plan. It does not have another generic. You obviously have to meet medical necessity for it. So for Ozempic, for example, you do have to be a diabetic, and you do have to, your doctor has to provide why you need to be on Ozempic to go ahead and get that approved. And if you were on Ozempic now under the state plan, which is Optum Rx, you would have definitely have gone through that prior authorization. So very important to note that there are brands that are covered. And really, as a whole, there will always be a drug for every single condition. So that's not to say that, oh, asthmatic people, we're not covering inhalers. No, there is definitely coverage, and there is a drug for every single condition. But again, the lowest cost generic option is what is covered first. And that is why they have that mandatory generics requirement under only the educators or the Garden State Health Plan. Someone here is asking about step therapy. Again, step therapy only applies to the Garden State or the educators plan. So I really want to make sure that we're on the same page about this. It's only for those two plans. And step therapy is where you are starting, in order to graduate or go to a more expensive drug, it's almost, think of it like a ladder, which is why they call it step therapy, where they are going to require that you start with a first level drug and then move on to step 2 and keep going through the ladder. But again, that is truly only for the educators or Garden State Health Plan. It does not apply to every single drug that's available, because if you're already starting with a generic, step therapy really doesn't apply. So just reach out to us if that is an issue for you specifically. But if your drug is a generic drug, it's going to be a $5 copay under the educators or Garden State Health Plan. If it falls under that preferred brand name drug tier, it'll be covered at a $10 copay. But again, I'll go back to this slide real quick. Just make sure that you're using the correct formulary list, and you can do the search right on horizonblue.com/pharmacy. Horizon really does a great job of presenting and listing all the medications in real time, that you can do that search directly using the link. Just make sure you're selecting the right list of drugs. Okay. Good questions. So going back, there was somebody that asked a question about mail orders, so here we go. So as of January 1st, the mail order carrier or provider for your prescription drugs is Amazon Pharmacy. That is a change that we want to make sure that for any of you that are getting your maintenance medication, usually mail order people are people that have a chronic condition such as diabetes, high blood pressure, thyroid, cholesterol. They're on these medications for the foreseeable future or for life. They're getting them mailed to them. So if that is a case that applies to you, you do need to go ahead and get that filled through the Amazon Pharmacy. That is the carrier that Horizon has to handle all of its mail order supply fulfillment. A new prescription does have to be obtained from your physician's office to go ahead and do that mail order request, irregardless of however many refills you may have left. So if you are somebody who does get their prescriptions delivered to their house, you will have to get a new prescription from your doctor. And once you have your ID card, setting it up is super simple. I myself get my medication delivered at my house through Amazon Pharmacy. And if you have Amazon delivering everything else in your life, delivering your prescription drugs is one more thing that they do a great job at. Once you have your ID card, you can go ahead and get that process set up. You will need your member ID number and all the information that will be on your ID card. So this is something that you can't set up now for January 1st. This is something that you have to set up as soon as you have your ID card and that you're active in the system. But again, we're letting everyone know now because, as I said, you will need to get a new prescription for mail order from your doctor. So that's something that you can definitely reach out to them ahead of time for. Your doctor can also, if they are like my doctor, if they want to submit it electronically for you, they can e-prescribe it at here, what we have on the screen. I know Adita emailed out the communication to everyone, so you do have this in writing. But since we're recording this, you can go ahead and pause here to write down this information. But yes, your doctor, as I'm sure with other carriers that are moving to Amazon Pharmacy, they'll be very familiar with this. And again, if this is an issue or something that applies to you, feel free to reach out to us. We will walk you through it, as with everything else, because that is what we're here for, to go ahead and make sure that this transition is as smooth and as seamless for you and your family. So next steps. If you are making a change, you do have to complete an enrollment form. Or if you're not currently enrolled and you want to enroll in coverage, you definitely have to complete an enrollment form. But if you are one of those people that are happy with the plan that you are, there is no action required on your behalf. You will just need to make sure you present your new ID card come January 1st. If you are someone who is waiving coverage or thinking of waiving coverage, you do need to complete the appropriate waiver form, and we have those on the IMAC benefits portal as well. I would highly encourage everyone to go on the portal to double check, how the plans compare to one another to make sure that could you be in a plan that saves you a little bit more money. Like I said, we have everything loaded in the portal right now for you, so you can certainly do that plan comparison for medical and prescription, since like I said, your medical plan will determine what prescription plan you actually go in. We do have very important, and I know this is a big topic, the Chapter 44 and Chapter 78 calculator. We have that on the portal right now as well. We also have great links on there as far as how to search for providers, which we do have a slide coming up because I know that was a question that was asked earlier. And you'll be eligible to switch next year if you want to make a change next year during your next open enrollment, which would be in October for an effective January 1st, 2026 date. So right now you're making a plan election for the entirety of 2025. And as I said, if you're happy with what you have, you do not have to take any action. But if you are going to make a plan change, you do have to do that by November 15th using the Horizon enrollment form. And get that form back to the Human Resources Office, to Adita, by November 15th. Very important. That is a hard deadline. Horizon needs time to process the enrollments. They need time to get all the ID cards out, which is why we need everything back by November 15th. I said it at the top of the meeting, but again, very much worth repeating. We have the IMAC benefits portal available. Everything that we've presented today, a copy of this presentation and a copy of this recording will be posted on the IMAC benefits portal for you. And obviously all the plan information is currently loaded there now as well. The link for the portal is imacbenefits.com. The guest key, which is the same for everyone, is Wallington, PS. So I highly encourage you to bookmark that portal link and that guest key, jot it down. Someone is asking, any chance the age requirement has increased for children in the dental plan? Currently, they must be off at the age of 23. Unfortunately, there are no changes to the dental plan. That is certainly a question you can post directly to the district. We at IMAC do not have control of that. But I can tell you that that's pretty industry standard. They age off usually 3 years before they age off of medical. So dental is usually 23, medical is always 26. But if your dependent has aged out off of dental, they are offered COBRA. So that's something to consider for your dental plan for your dependent that is aging out. But reach out to us. We can certainly walk you through that. As I said, the contribution calculator is posted on the portal right now. It's the 2025 rates now that you're moving into Horizon Direct for both medical and prescription. You do need Excel 2013 or later, however, to use the calculator. So if you're trying to do it with Google Sheets, which I know has come up before, that won't work. You have to have Excel 2013 or later. So if you don't have access to that, call us directly. I've been running numbers for people this entire month, really. We have other clients that are also in state health benefits. And we can certainly let you know what your numbers are going to be if you stay in the plan that you are now, and what those numbers would look like if you're considering moving to the educator's plan. People are always shocked when they hear what Direct 10 costs versus what the educator's plan costs, because the difference is vast. I was talking to a teacher yesterday who had a salary of $108,000, and for her, that switch represented about a $6,000 a year savings. So the savings are significant, but again, as we've talked through this entire presentation, the benefits are different, specifically out of network as well as with prescription. So while we understand that open enrollment happens every year, life does happen outside of that. Now that you're moving into Horizon, you do have 30 days, unless it's the case of a newborn, to go ahead and make any changes if you have a qualifying life event. So if, for example, if you get married January 1st, you have until February 1st to go ahead and enroll that new spouse. So please make sure that you understand those life event deadlines, or else you would have to wait until the next or the following open enrollment. Coverages are retroactive to the date of the event. You would need, however, to complete an enrollment form and present the proper documentation if that is a situation that applies to you. But again, you'll have open enrollment every year in October for an effective January 1st date. Since we talked about dependents that were aging out, that really is a good segue into this. Your children are covered until the age of 26 for their medical and prescription. At the end of the year, they age out. And when they age out, they have the following options available. They will automatically be offered COBRA if they meet certain criteria, such as, which we are going to get into in the next slide. They can actually stay up to the age of 31 on the same plan that you have right now. And if you have any dependents that are overaged with disabilities, there is coverage continuation for those special needs children over the age of 26. Certainly, we have those forms on the portal, and you can certainly reach out to us directly if any of these situations apply to you. But to Chapter 375, which is something that we like to highlight during every open enrollment, is that this is a New Jersey state mandate. So if you have any children that are over the age of 26 that will be aging out, so long as they are unmarried and don't have dependent children of their own, live in the state of New Jersey, or are a full-time student outside of the state, and are not entitled to any other group or Medicare coverage, they would be eligible to go on to the same plan that you have currently and stay there until the age of 31. The reason we mention Chapter 375 is because it is much less expensive than COBRA. It's about 40% less, believe it or not. COBRA can be very costly. I tell people COBRA rates all the time, and they think that I am talking about mortgage rates. COBRA is very expensive. If Chapter 375 is something that is applicable to you, I would highly encourage you to look into it. We have an entire page on the portal dedicated to this information. Someone earlier was also asking how to do the search for providers. This is not especially important for those of you that are in Direct 10, Direct 15, or the Educators Plan, because again, it's the same network, not only in the state, it's going to be the same network under Horizon Direct, but for any of you that are coming from the Garden State Health Plan, however, it is a different network because you're coming from Aetna to Horizon. So you would go to horizonblue.com/doctor finder, and you can do a search there for doctors not only in the state of New Jersey, but also, well, actually for the Garden State Health Plan, there's only coverage in the state of New Jersey. So really, you'd only be focused on the New Jersey network for that plan. But for the educators, the Direct 10 or the Direct 15, you can certainly search national providers as well if you're looking into that. So very important that you know that. But again, horizonblue.com/doctor finder. Horizon BFit, which is something that was also offered in the state, continues now that you're going to Horizon Direct. This is also known as the gym reimbursement. So if you go to the gym 12 days or more a month, or if you do your 10,000 steps a day, you can certainly sign up to get $20 reimbursed to you every month. You would have to go to Horizon B, just the letter B, fit.com to enroll. And again, you can begin earning that $20 even now if you haven't signed up for this previously. Horizon Blue 365 is Horizon's discount program that's still available to members even outside of the state. So you can go to blue365deals.com to sign up for this. Highly encourage that if you haven't signed up for this, that you do. There are some great discounts there, including discounts for LASIK eye vision surgery, for meal delivery services, discounts on Skechers sneakers. I'm a Horizon member myself, so I can tell you that great discounts for Horizon members here. And I also just want to highlight the Horizon app. It offers the same information that you can get on horizonblue.com, but the app is great because you can actually have it available to on the go with your digital ID card if you forget your medical ID card at home. With that said, that really brings us to the end of the presentation. Big takeaways for today. Make sure that if you are making changes that you get those forms back to Adita and the Human Resources Office back by November 15th. Please make sure that you get your ID cards. And if you don't get them by January 1st, call us. We want to make sure that we have the right address on file and that you get them in time. So please reach out to us if you don't get your ID cards by that last week in December, and check them for accuracy, but please make sure that you're presenting them. Very important that you're presenting them at your doctor's office come January 1st or at your pharmacy as well. Adita, is there anything else that you want to touch upon before we wrap up?
Not really. I think this was very informative. But yeah, that would be it from my point of view. I don't know if anyone has a questions after this webinar. I will ask them to call you or contact
Please,
you.
please,
And
yes. We want to make sure that we speak to everyone, and there is no silly question. We want to make sure that you have all the information available to make a decision of what plan you want to be in for 2025. And yeah, we're here to answer any questions that you may have.
yeah, thank you so much, Elizabeth.
Absolutely. Have a great weekend, everybody. Thank you again for joining, and we will talk to you soon. Thank you so much.
Thank you.
Bye-bye.